This is my research grand rounds presentation. The article that I chose was Comparison of the Mediterranean Diet and Other Therapeutic Strategies and Metabolic Syndrome. This was a systematic review and meta-analysis. For the client case, I chose case 5, which is metabolic syndrome, and I focused on metabolic syndrome. The background, metabolic syndrome is a cardiometabolic disease which is characterized by having a cluster of conditions such as dyslipidemia, insulin resistance, high blood pressure, and obesity. The ATP3 criteria is used to diagnose the condition, and it's based on having at least 3 of these. Metabolic syndrome has a high rate of prevalence worldwide, especially in Western countries, and may be attributed to an unhealthy diet. Here's the reference for the article. For the PICO question, for patient population, I put patient with metabolic syndrome. For the intervention and exposure, I put Mediterranean diet. For the control and comparison, I put standard diet, dietary advice based on the food pyramid, a low-fat diet, and no physical activity. For the outcome, I put body weight, BMI, waist circumference, systolic and diastolic blood pressure, triglycerides, glucose, total cholesterol, HDL-C and LDL-C, body fat, HOMA-IR, and insulin levels. For the search terms, I put metabolic syndrome for the patient population. For the intervention exposure, I put Mediterranean diet. For the control and comparison, I put no dietary changes, the standard diet, standard American diet, Western diet. For the outcome, I put clinical parameters, anthropometrics, blood work, and biomarkers. And you can see how I simplified the mesh term for this, just the biomarkers. Here are the qualifiers. Here's how they were indexed. And here are the key terms. For the search terms, the finalized list that I came up with was metabolic syndrome, Mediterranean diet, no dietary changes, and biomarkers. Here's the title again of the paper. In terms of an introduction, metabolic syndrome is part of a continuum that begins with insulin resistance. If it goes untreated, it can result in type 2 diabetes. Multiple biomarkers may be adversely affected, which includes high fasting plasma glucose, total cholesterol, LDL-C, HDL-C, and high blood pressure. Anthropometrics such as BMI and waist circumference can also be increased. The ATP3 criteria is used to diagnose metabolic syndrome. The more out of range the biomarkers and anthropometrics are, the more severe the condition is. The Mediterranean diet is a nutritional intervention that can improve or potentially reverse metabolic syndrome, as it is known to have positive effects on biomarkers and anthropometrics. It can improve insulin sensitivity and lower insulin resistance, improving fasting plasma glucose, hemoglobin A1C. It can lower LDL-C, increase HDL-C, lower systolic and diastolic blood pressure, and decrease weight, which could lower BMI and waist circumference. The systematic review and meta-analysis included 12 studies that looked at the effects of the Mediterranean diet on biomarkers associated with metabolic syndrome. For the methods section, this systematic review addressed a focused, sensible clinical question. It pulled together RCTs and experimental studies to determine the effects of the Mediterranean diet on clinical parameters associated with metabolic syndrome. This included BMI, waist circumference, triglycerides, glucose, HOMA-IR, and insulin resistance. The search was detailed and exhaustive. It included Medline, Embase, Web of Science, Scopus, Google Scholar, and CINAHL. The keywords included Mediterranean diet, Mediterranean food, eat Mediterranean, metabolic syndrome, and X syndrome or syndrome X. A total of 12 studies met the inclusion criteria. It also included studies from 19 different countries. You can see the Prisma flow diagram here and how they began with 370 studies and ended up with 12 studies that met the inclusion criteria. Were the primary studies of high methodologic quality? Yes. This included RCTs and experimental studies, which are higher methodologic quality compared to observational research studies. Certain authors were designated to perform the validation. The Cochrane biased assessment and grade was used to analyze each of the clinical parameter outcomes. Was the search for studies and assessment of studies reproducible? The search for studies was performed by multiple reviewers and a consensus was required. There wasn't any information about the search for studies being reproducible. What were the results? Were the results similar from study to study? The outcome and results from the 12 studies included the effects of the Mediterranean diet on the 13 clinical parameters. Many studies included most of the clinical parameters, while others reported on a few of the clinical parameters or other details. The mean difference was the value that was determined for each of the clinical parameters. Confidence intervals and p-values were also provided. There was a forest plot provided for each of the clinical parameter outcomes. When comparing the Mediterranean diet versus the standard diet, most of the mean differences from the studies were on the left side of one of the forest plots. As a result, the diamond, which measures the average effect, was also on the left side. The only clinical parameter that had the diamond on the right side, favoring the standard diet, was for HDLC. For body fat, the diamond was very close to the middle of the Mediterranean diet versus the standard diet. For about half of the forest plots, there were wide diamonds, which indicate that the pooled estimate for the confidence intervals wasn't precise. Do the confidence intervals overlap? There is some overlapping of confidence intervals from study to study. Are the differences greater than would be expected by chance? For many of the clinical parameters, of which there were 13, the differences between studies were greater than could be expected to occur by chance. Chance would indicate random mean differences. 10 of the clinical parameters had mean differences that aligned on the left side of the forest plots. Was there a formal test for heterogeneity? The I-squared statistic was used to assess heterogeneity. For all the clinical parameters, the I-squared indicated substantial and considerable heterogeneity, which was 50 to 90% and 75 to 100% respectively, except for BMI, which had moderate heterogeneity, which was 30 to 60%. What are the overall results of the review and how precise are they? The overall results indicated that the Mediterranean diet had a positive effect on many clinical parameters, and this indicated by the mean differences aligning on the left side of one of the forest plots, which favors the Mediterranean diet over the standard diet. For each of the clinical parameters, there was a combination of narrow and wide confidence intervals. The wide confidence intervals indicated a lack of precision. Some of the confidence intervals overlap and some cross one. Conclusion of the article. How similar are my patients to the patients in this review? The results of this systematic review and meta-analysis may be applicable since many patients have insulin resistance, metabolic syndrome, type 2 diabetes, and non-optimal clinical parameters. Are any postulated subgroup effects credible? Various demographic groups may be considered subgroups, which included different locations, dietary habits, age, sex, and body weight. Individuals with different ages, especially older ages, may be more likely to have certain comorbidities related to metabolic syndrome. The study didn't appear to attribute treatment effects of the Mediterranean diet to different subgroups, but the meta-regression did take age into account. Is the intervention feasible in my practice setting? Yes, it is feasible to recommend the Mediterranean diet. Were all clinically important outcomes considered? Yes, there were 13 clinical parameter outcomes, and these appear to be adequate to measure the effects of the Mediterranean diet on metabolic syndrome. Are the benefits worth the costs and potential risks? Yes, there is potentially very little downside to recommending the Mediterranean diet and very much upside. What was the risk of bias? Figure 2 and Figure 3 show the Cochrane risk of bias. More studies showed a low risk of certain types of bias compared with fewer studies that had a high risk of certain types of bias. So you can see that green represents the low risk of bias. The yellow indicates unclear risk of bias, which there is no yellow. And then there's also a little bit of the red, which is the high risk of bias. Strengths of the study. This study demonstrated the benefits of the Mediterranean diet on many clinical parameters and quality of life associated with metabolic syndrome. This study was from 2025, so it was very recent. Limitations of the study. The dietary definitions differed across some studies, which could alter clinical parameters of metabolic syndrome. Also, studies that had the Mediterranean diet combined with other treatments could impact the results. There may be publication bias, as studies with conflicting results may not have been published. Other factors other than the Mediterranean diet by itself may have contributed to the improved clinical parameters. There was variation across studies. They all didn't compare a basic Mediterranean diet to a standard diet. They used different macronutrient ratios. In one study, the experimental group included calorie restriction. Another study combined the Mediterranean diet with extra virgin olive oil, and another group with the Mediterranean diet and nuts. Other studies included physical activity and CBT in the experimental groups. The search for methodologies had limitations in sensitivity and specificity, which could have affected the inclusion criteria. Studies were excluded where the measurement units of the parameters didn't line up. This may be a form of bias, as it could have excluded articles that would have affected the results. Also, the high heterogeneity limits the generalizability. In terms of a benchmark, I gave this article a B+. The systematic review can be applied to the case. The overall results indicated that the Mediterranean diet had a positive effect on many clinical parameters. However, there was moderate bias, lack of precision, heterogeneity, and other limitations. For the therapeutic decision, I put that the recommendation for the patient with metabolic syndrome is to follow a Mediterranean diet with extra virgin olive oil, to limit refined carbohydrates and added sugars, and to incorporate physical activity in the amount of 150 minutes per week. Also, high intensity interval training for 3 days a week can be done with less than 15 minutes of exercise per session. Goals include lower weight to achieve a BMI less than 24.9, lower blood pressure to ideally 120/80, lower fasting plasma glucose to less than 100, lower LDL-C to less than 100, and increase HDL-C to greater than 40. Finally, educate the patient on the health benefits of the Mediterranean diet and provide relevant research articles. Here are my references, and this concludes my presentation. Thank you.